So hi, I'm Russell de la Peña. I'm a property specialist for Ayala Premier. So I met Dr. In one of our projects in Morong Bataan, which is in Anvaya Cove. And I'm here today because I have open pores and visible scars. So as Doc recommended, I'm here to have a Juvelook, which will enhance and minimize my visible pores and acne scars. So what it does is it enhances my the skin texture, the moisture, and boosts also my the skin collagen. So yeah, don't forget to click the subscribe button and the notification bell to keep you posted.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a first-time guest. Let's all welcome Sir Russell. Welcome, Russell.
Hi guys.
Yeah. How are you today?
So I'm doing well. I'm doing great.
And how young are you?
I'm 28 years old.
You know, aging starts at 25?
You said that.
Because there's a rate of collagen depletion that would start at the age of 25. So there's like 1 to 2% collagen breakdown, and it starts at that age, okay? But there's this book saying like there's already a 10% collagen reduction when you're 25 and above. Yan. So, pero nabawasan ng 10% yung collagen mo sa skin mo, no? And considering the skin, the primary component or the major component of our skin is collagen. That's why nowadays, you've been hearing a lot about collagen biostimulators. So, people are already staying away from too much of hyaluronic dermal fillers because they don't want to have that overfilled syndrome or puffy face. Especially Asians, we have round face. Yan. Ano bang shape ng face mo, Sir Russell?
As you can see, medyo round.
Yan, because we have round shaped face, so we are wider on the mid face. So a lot of our patients right now, they don't want to use any more volumizer because they don't want to further widen their face or increase the volume of their face. So the trend now is collagen biostimulator. So these kinds of products, they help in regenerating your collagen, improve your skin quality, also the skin tone, the skin texture, plus also those with concerns of open pores or large pores, and even atrophic acne scars. Nung teenager si Russell, marami sigurong acne.
Oh yes, Doc. For sure.
Laging napupuyat, kaya laging may acne. Masipag mag-aral. Because that's our concern with Sir Russell here. He has this like on the temple. If you look at the temple, some presence of atrophic acne scars, sunken scars, and also mid-face on the cheek area to the lower part of the face. So the combination of acne scars, we have those like your rolling scars, backscar scars, ice pick scars, and other types of scars. So we want to treat that. We want to manage that. At the same time, improve the texture, the quality of your skin, and restore the hydration. Go ba tayo?
Go, Doc.
Of course. Since nandito ka na rin, check mo yung skin quality mo. Di ba? You notice some presence of large pores, particularly mid-face area, sides of the nose, and also nose area. And noticeable yung mga sunken scars mo from the temple to this area of your mid-face, even a little bit on the lower part of the face. At saka sa forehead, medyo may mga dynamic and static lines and wrinkles. We also want to manage that. Even under eye area, some concerns of like hollowness or even fine wrinkles on the under eye area. At saka, syempre, your kailangan masculine face. I was assessing your face a while ago. I was doing the rickets E-line like this. So, you look at that side. Pag rickets kasi, tip of the nose, lower lip, and the chin. So they did not meet the criteria.
Oh my gosh.
Oh my gosh! Yan. And I was looking at the angle, this part, medyo blunt yung angle mo dito. Yan. So, kailangan natin gawan ng paraan, Sir Russell. Okay, so what kind of treatment, what procedure, we will show you when we return. And we're back, so we are with Russell and we are going to treat the atrophic acne scars. But at the same time, we want to improve the quality of the skin, the tone, the hydration, the texture. And we also want to help with the large pores and also overall like a total skin quality improvement. Right, Russell?
Yeah.
So we will be using a collagen biostimulator, which is the so-called Juvelook. It's very famous right now. And this product has this component called PDLLA. So those are polymers of lactic acid in a D and L isomer. So those are molecules that will stimulate your fibroblast cells to synthesize new collagen, the type 1 and type 3 collagen of our skin, to bring back our skin in that youthful state. So we already have prepared our Juvelook vial here. So my technique will be via the cannula method, okay? I'll be making an entry point whereby I want to target the atrophic acne scars. So that will be our indication for Russell. Actually, there are other indications for this to also tighten skin, those people with loose skin already, or also fine lines, wrinkles, and even for the under eye region, open pores, large pores, okay? So many other indications, even for neck, even for hand rejuvenation, you can use this Juvelook, okay? So we'll be starting with, of course, you cleanse the skin, you put on your topical numbing cream, then cleanse it again, and then also we will be using, so I'll be changing my gloves. We will be using a cannula. So with a cannula, we'll be having our introducer needle, okay? So we still observe a so-called aseptic technique to make sure that we don't have any infection, okay? Now, the polymer PDLLA, actually, it has already been used by a lot of clinics already. It's famous, it's well known. So I'll be needing an entry point. I'll be starting with the temple region. So I'll have an entry point here. So at the zygomatic arch here, I'll make a tiny prick there. Just a simple prick there. And then I have my 1 ml of the prepared Juvelook, okay, pull out. And then I have this gauge 23 cannula here, and let's direct it. So ideally we place it, if you want a collagen biostimulator, you place it in the subdermis section where you also have your fibroblast cells, okay? So I'm just gonna glide towards the plane here. You want it in the subdermis, subcutaneous layer there. You're good, Russell?
Yep.
Okay. So I'll make a first line there. So it's a fanning technique also here. Actually, we also deliver the Juvelook via other means. So we also have like a multi-needle injector, which is also a very good method to deliver this kind of product. So you want to target directly the dermis, deep dermis or reticular dermis, where you also have a lot of your dense collagens, particularly your type 1 collagen. So I'm done with the temple. Let me proceed with the anterior or the anteromiddle cheek part, okay? So for this one, I'm placing just tiny aliquots also, but make it even and equally distributed in the subdermis plane. So you're good, Russell?
Yes.
Okay. Just gonna glide. Okay. So it's normal to sense some resistance because of those atrophic acne scars. Your scars have these fibrotic bands. So we're also like doing a so-called kind of like a subcision technique already. You want to release the fibrotic bands beneath. So it's normal. It's subcising also. So once you subcise those fibrotic bands, you place this PDLLA, and it's gonna create scaffolds of molecules inside to regenerate your skin from within. So it's normal. There's this fibrosis. Okay. So I'm also doing kind of like a subcision already. Actually, we do subcision for cases of atrophic acne scars, boxcar scars, and even those rolling scars, ice pick scars. Okay ka lang?
Yes.
First time mo ba, Russell, for this kind of procedure?
Yes.
Okay. In the past, what have you done? Meron kang mga lasers?
Fraction.
Fractional. Okay. Because Usually, acne scars, we start with some devices. You can do your fractional CO2 laser. The others are using other kinds of devices. RF microneedling. Have you tried RF microneedling?
Not yet.
Not yet. So, just CO2 fractional, right? So, I'll be using 2 mil for one side. Then, we'll help also Russell here with his concern of the chin projection and chin elongation. We'll be adding a little bit of some high G prime molecule there to improve that, okay? So, it's normal to have this resistance. So, it's already expected. Okay? And we'll go with the second mil. So, I'll also target the preauricular region because Russell also has some of the atrophic scars extending before the ear area. Okay ka lang, Russell?
Yes.
Okay. So, redirecting the cannula here, we'll go towards that, first this angle, and then we'll go in front of the ear. Yan. So, normal lang. Okay naman eh. Tolerable, right, Russell?
Yes.
So, I'm gonna go here, direct it here. So, usually I put my sterile OS below the cannula and then just glide it there. So, some subcision effect. So, this product was already hydrated. It was diluted with our diluent. So, you have to prepare it. Like, you can have it like 24 hours prepared before doing your injection, or sometimes we use also the so-called vortex to prepare this material. So, some resistance because of the acne scars. Yeah. So, actually, the PDLLA, they promote collagen formation. So, usually, collagen formation would start on the 3rd week to 4th week. So, gradually, you're seeing improvement already. And you do a repeat session of this. So, like I have patients who do collagen biostimulator once a month for 3 sessions. So, I'll go back with the anteromedial to the inferior aspect of the face just to complete the 2 mil of my product here. Okay, so, entry point again. And then, I'll be adding high G prime material. I'll be using a simple technique for that. I'll be starting with a minimal amount of my high G prime for Russell, so that, because he will still come back for another session, right, Russell? He's also a busy person. Okay. See, you hear those sound of like releasing the fibrotic bands. Yeah. We're releasing fibrotic bands also. Okay. So, combined with subcision already. So, those with problems of acne scars, you can use your Juvelook to regenerate the dermis layer and kind of help with the improvement of those sunken scars. So, I'm sensing all those fibrotic tissues here. Okay, we need to release those. Okay, that's normal. You're hearing those cracking sound. So, we want that to be improved. Okay. And we'll place a little bit for the under eye section here. So, my Juvelook, actually, we can do a so-called cocktail of your Juvelook. You can combine with your neuromodulator. You can combine with your non-cross-link hyaluronic. You can combine with the pure collagen to boost the effect of this PDLLA. So, a little bit more there, a little bit more there, and there. Okay, so we're done with our Juvelook. Okay, Juvelook stands for juvenile, youthful, and the look, youthful look. Okay, so a little bit for the chin improvement here. We want a chin projection there. Now, since we have Russell, we want a masculinized chin. So I just wanted to work in the symphysis menti here, aspirate there. So I'll just deliver like a 0.25, 0.25, 0.25, 0.25 for every injection point that I will make. It's a combination, elongation, and projection, okay? So we do markings for this. So for my students, I teach them where is the injection point, what is the anatomical layer, how much to place for every injection point. So there are like trainings for this that we do for our doctors, okay? So you should have that so-called clinical eye for aesthetics, ratios, and proportions. So I'll just first like a 1 mil for Russell for now. Then we will do another session for him to improve the treatment. Then I want to improve the angle of the mandible since it's already blunt, Russell. So it could be, for some people, it's something that they inherited. Others had this from aging because of the bone, the mandible becoming shorter. So I think Russell also has this like features in the family, right? So the angle is here. So if we inject for men, we want to go anterior to the angle of the mandible. So I'm just gonna go directly to the bone. So you just have to feel for the bone here. So there's the bony structure already. And I'm just gonna do a bolus injection of this material, okay? So after doing this, we will shift to the left side, completing the so-called Juvelook full face. Actually, we didn't do the forehead and under eye periorbital, but you can also include that. Okay, so we're done with the right side. We will now proceed with the left area. So we have done the Juvelook treatment left and right via cannula method. Right now, we'll also be combining it with the multi-needle injector, the so-called Derma Shine, to kind of also complete with the multi-layer approach. So we also want to go to the reticular dermis, deliver the product there, and further rejuvenate. Okay, so I have my device here. So this is like an automatic kind of like a device. Okay, you will hear the needles going in already without pressing on anything. But you can also go back in one area there. So it has the suction effect also. And it's already injecting the solutions in the reticular dermis. So I'm targeting actually the scar area. So I want to improve the skin quality of Russell. Yeah. So in one treatment, we want to expect a big improvement. Probably around 50%. Because it's a multi-layered approach. We did the subdermis, we did the reticular dermis, so it's gonna really give that good result in one treatment, right? Yeah. So I'm just using a depth of 1 millimeter. You can use up to the 2 millimeter depth because you are targeting also the so-called, you wanna go to the dermis layer, okay? So we have a solution here made up of your PDLLA Juvelook. So after a month, you come back to me, Sir Russell, so we can do another session of this one, okay? Yeah, it's something tolerable, okay? Okay. So after that, let's also do temple area where we have also scars here. Then you can also do the forehead region because we have fine lines. So we want to improve totally the skin quality. Yan. So nowadays, people wanting a treatment to have a refreshed look, rejuvenated look, at the same time collagen stimulation, but not looking overfilled. A lot of people will want to do something that it's not so obvious that they're doing a treatment, right, Russell?
Yes.
Yan. So this is a polymer product with the target of activating the fibroblasts to synthesize new collagen. Okay, so after this, let's proceed to the left side. So we have done the multiple procedures for Russell. We'll show the result when we return. And we're back. Let's show the result to Russell. Russell, here's the mirror and check on your face right now. Because a while ago, he was concerned if there is a downtime for this one. But looking at his face, there's no bruise. There's no like too much of a swelling, okay? But we see already the stretching of the skin. Plus, I noticed the atrophic acne scars were already, they were stretched and kind of like elevated already. The sunken part was elevated already. And this one, we will still see improvements as time passes by. Like for example, the 3rd week to the 4th week, you're already having that collagen regeneration. So like a young collagen is starting to be produced in your dermis layer. And then we tell our patients to do the treatment after a month again, so we can have like a total of 3 sessions for this one. And it's a case-to-case basis depending on the indication. So we will pattern the number of sessions and also the amount of vials that we will use for every patient. So how was it, Russell?
It's all good, Doc.
It's all good, right? How was the experience during the procedure?
It was painless.
Yes. Okay.
And then it was quite fast,
Yeah.
honestly.
Yes, it's a quick treatment. It's a quick procedure. We call it also lunchtime treatment. Like you have a break, you can do it in an hour of your break. So actually, the Juvelook is known for being a painless treatment. So our approach was via cannula method plus the device Derma Shine, which is so good because it really delivers the molecule in the reticular dermis where we need to activate more of our fibroblast cells. Yan. So skin quality mo, anong na-notice mo?
Ngayon mas shiny, Doc. And then for my scars, nag-lift na yung skin ko. That's the first thing I noticed na for the scars.
And more improvements will be noticeable as time passes by. So this is like a continuous remodeling and regeneration inside the skin tissues. So we actually combined our treatment in 2 layers. So we did the subdermis and we also did the deep dermis. So it's gonna be really effective. And if you have the 2nd session to the 3rd session, the more effective it will be. Like in one treatment, we want to expect, like for example, 20% to 30% improvement, and then second session, like 30% to 40% to the third session until you complete the 100% improvement in your skin quality, skin condition. Plus also, we want the atrophic acne scars to really be treated, to really make them not obvious, okay? Because he has the combined acne scar problem. So when we have combined acne scar conditions, we also do some combination procedures. So actually, we still recommend other kind of devices as well. But you had the microneedling. Take note, the microneedling itself, it's also a collagen induction therapy. So you had combination procedures. And we also did chin enhancement. So what did you notice with your chin?
Yeah, medyo visible na siya.
Yeah, it's within the proportions already. So we did the rickets E-line. After that, we've noticed that it's already within that rickets E-line. And we only used actually I added 1 ml again. We'd only use 2 ml for the chin projection and the chin elongation. And actually we need a little bit more. But we would just want to give like, sessions of this so that tomorrow is not going to be very much swollen. It's going to be really very heavy on the chin area. And a little bit on the angle of the mandible. Actually, he would still need additional treatment for the angle of the mandible plus that jawline there to make it more defined. So we'll do that in his next treatment, next session. Thank you, Russell.
Thank you so much, Doc.
Yeah.
Thank you.
Do you have any social media if they want to follow you?
Yeah, you can follow me on my Ayala Land Premier page. It's Ayala Land Premier by Russell de la Peña.
Uy, Ayala Land po. Okay. Baka interested din kayo kumuha ng properties sa Ayala Land. You just message Sir Russell here. And if you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics, and our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0923-860-9193 or 0917-504-4268. And please do watch our other episodes, and Sir Russell will still have another episode with us. So, abangan natin yung further improvement ng kanyang mga atrophic acne scars, plus of course, the jawline definition, the chin definition for a more masculine look and youthful look. Kaya nga, Juvelook. Okay? So, thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.